Thank you, Chairman. Good morning, all the delegates. At the outset, I would like to thank the organizers for giving me an opportunity to participate in this symposium. So the subject given to me is impact of paternal age on semen parameters, including DNA fragmentation index. Just to introduce the subject, as every one of you know, male factor infertility accounts for about 30 to 40-50% of all evaluations of infertility. That comes to about 70% of the men all over the world are infertile. That's a huge number compared to any other disease. 7% of the entire male population is infertile. That is mainly because of the low semen quality, often obligates the use of ART. However, the association between semen quality and ART outcome is still controversial. Advanced paternal age, I would like to just brief it as APA in future, has long been postulated to negatively affect the semen quality, ART outcome through DNA damage within spermatozoa. As you know, the age of the male partner is being increased. Over the last decade, there has been a significant increase in average paternal age when they marry and also when they produce the first child. It is because of the increased life expectancy. Earlier, when India got independence in 1947, the life expectancy was only about 32 years. Now it is 72 years. There is increased life expectancy, widespread use of contraception, late marriages due to professional commitments, higher education, and increased socio-economic factors all have contributed towards this increase in paternal age. The effect of APA on reproduction are various, as you can see in the slide. Sexual function activity, nutrition and lifestyle, telomere shortening, genetic genome stability, decreased hormones, inflammatory and immune diseases, oxidative stress, all these are going to affect the fertility of the person. The risk factor of APA, risk of an accumulated damage from infections, alcohol, tobacco. See, for so many years the person would have smoked, and for so many years alcohol would have been taken, and that all accumulates the toxins with increased age, and all this likely to affect the genetic integrity of the sperm DNA. And antioxidant capacity decreases with age, especially ROS, that is reactive oxygen species, may also increase with age, resulting in oxidative stress and DNA damage and increasing apoptosis and testis. Combination factors is likely to contribute this outcome, and additional research is required in this field. Coming to seven parameters, the WHO is little more liberal in 2021, which has decreased the semen volume as 1.4 ml. Earlier it was 1.5 ml as a limiting factor. And the sperm motility, it is remains same, 39%. But the motility has been increased to 42%. Progressive motility has been reduced to 30% in WHO, that is the cutoff time for the infertility. And non-progressive motility has not been changed. And immotile sperm, that is reduced to 20%. Vitality is reduced to 54%. And normal forms remain same. So most of the laboratories which give the reports, they don't mention the 2021 WHO standard. Most of them, they still give only the sperm count and motility, which is sometimes they say that 50% or 40% is the cutoff of this one. So I request all my esteemed colleagues to note the 2021 WHO standard as for the semen parameters. And how the age affect these parameters. As you can see, as the age advances, most of these semen parameters have been affected. If you note in the slide, between 21 and 28, the volume is 2.86 ml, and whereas when it is increased to 29 to 35% age group, it has come down to 2.7 ml, and 36 to 42, 2.4 ml, 43 to 49, 2.4 ml, and beyond 50, it is 1.7 ml. That shows that the volume is going on decreasing as the age advances, as well as the sperm count, total count, between 21 to 35 is not much change. It remains between 144 to 149. Whereas when they crossed the 35-36 years, the count came down to 120 million per ml, and between 43 to 49, it came to 112, and beyond 50, it is only 61 million. That shows that as the age advances, the sperm count is decreasing, and the motility also between 21 to 35, not much change, but when they reach 36, it comes to 40%, and 43 beyond 33%, and beyond 50 it is 31%. Even the morphology is grossly affected. From 26 to it came to 19%. That shows that the effect of the semen parameters as the age advances. The effect of APA and semen, volume decreases, count decreases, motility decreases, morphology decreases. And on sperm, epigenetic factors, my colleague is going to speak, I will not touch upon that. Sperm DNA integrity is decreased, telomere length is decreases, fragmentation increases, mutation increases, chromosomal aneuploids increase, and few studies interestingly have shown that the aged parents, especially the aged male factor, the chances of female baby getting born are increased. The mechanism of APA is the seminal vesicle inadequacy, that is all the internal male organs, seminal vesicles, prostate, epididymis, and bulborectal glands, they all shrink. They are the contributory factors for this DNA changes. And chromosomal aneuploidy, another speaker is going to touch. I will not go into the details of these aneuploidies. And DNA fragmentation index, the sperm stored in the sperm head within the chromosome. DFI test is the test that measures integrity of DNA present in the sperm head. DFI is a result of single or double strand breaks, which can be measured by two chromosomal methods, that is sperm chromatin study structure assay, that is SCSA, and tunnel test, that is tunnel deoxynucleotide transferase mediated ubiquity neck end labeling assay. This assay cannot differentiate between the apoptosis and necrosis. The result, whenever you see the results of this DNA fragmentation, if the DNA fragmentation, if they have reported more than 50%, that is alarming. Between 28 to 50%, they require treatment, and if it is below 15%, you need not worry. So the cutoff you should know that is 50%. The effect of APA and DFI, a study has shown that men above 50%, the rate of DNA fragmentation index is 4.58% than the men below the age of 30%. That 30 years. That is, between 30 years and 54 years, the DNA fragmentation index has gone by 4.58 times. The above 45 years, it is associated with higher DFI. These findings may be due to decrease in sperm apoptosis, increase in DNA damage, and decrease in sperm apoptosis in older men. The cutoff age is 35 years. But another study has found that high DNA damage also were more likely to have abnormal semen parameters. The effect of APA and DFI, some of the potential causes of DFI in sperm are abnormal protemination and abnormal proteminase compaction. It is attributed to presence of histones that are not converted into proteminase and results in protein deficiency. Oxidative stress plays a very important role as a result of increased production of ROS or reduced oxidant reserves is responsible for majority of DFI, seen as a result of infections, chronic infections, inflammations, alcohol, smoking, etc. Most of these lifestyle modifications of the aged person, they are going to affect the available oxygen. Oxidative stress induced DFA in APA. The sperm, you can see in the picture that yellow mark, yellow blasted area, that gives rise to the DNA fragmentation. And this DNA fragmentation is due to decondensation, exposures of DNA to ROS generated from several sources including mitochondrial dysfunction. These ROS can induce DNA damage in the form of double or single stranded breaks. And oxidative stress can result in the conversion of guanine nucleotide to 8-oxyguanine orange, that is which is shown in the orange. In summary, most of these ROS results the effect on the mitochondrial dysfunction, which later on results in the DFI. DNA integrity and reality outcome. Another speaker is going to touch upon the DNA integrity and reality outcome. I will not just go into the details other than telling that DNA fragmentation index is an index for the reproductive outcome of the male. So to conclude, there are negative effects of increasing paternal age on various molecular mechanisms such as DNA mutations, chromosomal aberrations, epigenetic patterns. This molecular aging process was also shown to induce changes in reproductive hormone profile, decrease sperm quality parameters, and contribute to male infertility. These alterations are also responsible for various types of congenital disorders, pregnancy outcomes, which is going to be touched by another speaker, such as spontaneous abortions and preterm births. I hope to raise awareness among both clinicians and older couples to the risk associated with delayed fatherhood, which may compromise their parenthood dreams as well as their quality of life. So here, my esteemed colleagues, there are tendencies of the couple postponing the first pregnancy. They go on having the contraceptives, they're telling that they want to buy the house first, buy the car first, and to attain higher things in their profession and have higher education. So they go on postponing the first child, and the result is the age, advanced paternal age as well as maternal age. Everyone knows that as the mother's age increases, maternal age increases, definitely there is an effect on the outcome. Similarly, as APA, that is the advanced paternal age, is equally important, and we have it's our duty to advise all the newly married couple to have the first child as early as possible and not to postpone the second child also. So not to give so much gap as 5, 8, 10 years, because at that time the mother and the father would have crossed 35 years. And dear friends, 35 years is the cutoff time for the paternal age, just like the maternal age. So advise your couple to have the first child as soon as they are married, and to have the second child as early as within 3 or 4 years of the first baby, so that we will give to our society better children, so that they are not affected by epigenetic, molecular dysfunction and DFI. Thank you very much for giving me an opportunity.
Thank you, Dr. Sharath.